HIMS stock is about to explode due to two major themes. It's over. It is over. We're going to talk about these two themes. The grift is over. Big food, big pharma, it's done. Healthcare, none of it works. The food is poison. The healthcare doesn't work. It's all reactive. It's not preventative. Big pharma, don't even get me started. It's gotten so bad that the government had to step in and they had to say, this isn't working and health insurance, costs are too high and we need to get the health insurance costs down. That's when you know maybe there's a problem here. But HIMS is going to benefit in two major ways. Number one is I think that we're seeing this happen already, and this is going to be the theme of the next 5 years. And I think HIMS truly is going to 10x in the long term. I'm not talking about tomorrow. I'm not talking about in a year. I'm in the stock for the long term. It is going to 10x for these two reasons. Number one, the theme of not dying. It's becoming cool. Taking your health seriously is becoming cool. Think about this. How much money do we pay every month? We pay for these subscriptions to watch endless slop on Netflix. We pay for these subscriptions to buy 100 Hostess donuts at Costco. We pay subscriptions to buy endless stuff on Amazon. I'm guilty of that one too. And Costco, kind of. We pay for these subscriptions. How much do you pay for these subscriptions? Let me know in the comments below. What do you pay for all these subscriptions to watch videos that aren't worth watching? Except on YouTube, of course. Keep the YouTube subscription if you have it. Netflix, whatever. Let me know. And then tell me, what would you pay for a monthly subscription that would keep you healthy? That would make you live longer, that would keep you healthier, that would make you have more energy, that would prevent you from getting sick in many cases. I do think that a lot of, there's so much I want to talk about, and I'm going to get to it in future videos. I think a lot of this has been sparked from my own health journey and just how much I have figured out in the last year just by taking matters into my own hands, saying health insurance is insane. I was paying $500 a month for literally nothing, just setting money on fire, just hoping I don't go bankrupt if I got hit by a bus or something. That's all it was good for. And even then, if I ended up in the emergency room, these health insurance plans, I pay for my own. If you get one through your job, consider yourself lucky. But I can't imagine people out there who are trying to pay for this stuff with a family of four. What is it, $2,000 plus a month? That's a mortgage, $24,000 a year. But it's not even like your insurance kicks in there. Your deductible is probably $15,000 or $20,000. You're maxed out of pocket. So you're paying $24,000. Then God forbid you end up in the hospital. You're probably on the hook for another $10,000 to $15,000. I know I was. This is a whole other thing that I'll talk about in another video. I found the solution, so stay tuned. But HIMS is going to be the top of funnel for healthcare. It is going to solve everything minus emergencies. So they don't have the solution for emergency, but everything else you're going to do through HIMS. Why is that? They are building this platform that has everything. And as I alluded to in the beginning of the video, I truly believe we're at the breaking point. The dam is going to break. It cannot be held back any longer. People have caught on to the grift. The hair has been pulled over the sheep's eyes. We cut the hair. We can see now. It's over. And I think that this really started, I and many people, we give things like social media a lot of flack. I think one of the biggest benefits that we got from social media has been podcasts, has been decentralization of voices. You have controversial figures to some who talk about health. I mean, Andrew Huberman, Joe Rogan, they have talked about a lot of stuff that has turned out to be true. Are they always right? No. But isn't that what the whole scientific method is about? It's about questioning what we think is the truth and finding out how the world really ticks. That is science. That's what science is supposed to be. Okay, going off on a little tangent here, but it's happening because of these people, because of this decentralization. The truth is coming out. The powers that be, the big grift, it's over. They cannot hold the truth back anymore. And so what are we figuring out? Oh, maybe all the food with all these additives, maybe we shouldn't be eating that garbage. Oh, maybe all these diseases, if we fix the inputs and we test you and find you're deficient in X, Y, and Z, and we start supplementing those, maybe you don't get sicker, maybe you don't get worse, maybe you can even prevent yourself from getting these diseases in the first place. And I think that this is what HIMS is getting at. So the point I'm trying to make is, I'm trying to keep this one not too long, HIMS is building the one-stop shop that is going to keep you healthy. You are going to pay them a subscription, and it will largely, I think, minus emergencies and freak things, but 90% of ailments, or, when we talk about serious things that you develop over time, call it your, diabetes and cancer, but on a smaller scale, just your quality of life, having more energy, fixing your sleep quality, things like this. I truly believe HIMS is building the one-stop shop that they are going to do all of this. So how are they doing that? They have so much. I mean, I've been talking about this in several videos. You guys can go back and watch, but they just have so much data. They have a flywheel that's forming here. They get you in the door. Management, I think, has been incredibly disciplined. They choose these needs, these pain points for customers and patients. They start there at these needs that are, in the case of their origins with, the boner pills or ED or testosterone and menopause as, newer treatments that came out in 2025. These are stigmatized things. People struggle with them, but they don't really know or want to talk about it to someone like face to face. It's uncomfortable. And there also just have not been historically good treatments for it. And now all this evidence is coming out how much better your quality of life can be if you treat, if you're an aging male and you have low testosterone, or you're a female and you're going through menopause. The quality of life you can improve if you treat these things. We're just starting to understand. And it also, there's evidence that shows that if you treat these things, low T and menopause, if you treat them effectively, you actually start reducing your risk for heart disease. You reduce your risk of getting all these other ailments. So the point is, HIMS is doing it all. So the question becomes, how much money can HIMS make? I think everybody on planet Earth is a potential customer. They have 2 million something subscribers out of 8 billion people. Now, in the countries they actually serve right now, maybe the possible market is about 500 million. Between US, Canada, they just moved into about 4 European countries with their Zava acquisition. But that is the market. I think everyone out there can benefit from something that they offer. They just bought a labs company last year. You can do all your blood work now through HIMS. And I believe that blood work, this is the big part of it. Again, after personally experiencing this in the past year, I didn't go through HIMS, but I did pay to just get all my blood work checked, my vitamins, minerals, insulin resistance, the works, like 150 biomarkers. And what do you know? This isn't the stuff they kind of routinely do at your physical. They might check 30 biomarkers. They might say you're vitamin D deficient, but I was never told in my life that I had high insulin resistance, or your iron is too low, stuff like this. It makes sense that that's the starting point, because you can get ahead of things. If things are out of whack, you can catch it early with the blood work. And it just so happens that HIMS is now going to help you, and HERS. HERS has 1 billion, or just past $1 billion in revenue, or I'm sorry, it's on pace to do $1 billion in revenue in 2026. That's essentially becoming 50% of the pie. Where was I going with this? HIMS is building like every stop of this shop. It's the one-stop shop. So you do your blood work, you figure out if anything's wrong. If not, you become a routine customer. Maybe you do this once or twice a year. I think the more the better, but I know people do it quarterly. It just becomes a function of money. And that's the other thing. Historically, all of this has been reserved for the ultra rich, the ultra wealthy, who had the access and the money to pay for this stuff, but it's all becoming cheaper. So it's becoming accessible to everyone. So you're going to do your blood work, your comprehensive lab, and you're going to find out maybe early warning signs, early detection. Okay? But that's not where it stops, because then HIMS can prescribe you exactly what you need, whether that's supplements, whether that's personalization is the big part of the bull thesis for HIMS. I can go out there, I can buy a multivitamin, but it's not tailored toward what I need. I can go out there, I can talk to a primary physician, and they're just going to give me the generic, what they tell everyone. Oh, it's winter, take your vitamin D, do you exercise, how much do you drink? Not at all, And that's it. But you go on HIMS, it's like, oh, these 10 things are off. You need a specifically tailored, multivitamin or some sort of supplement that specifically targets those. And we don't need to target the other things. Your levels are fine. This has not existed historically for the mass market. HIMS is bringing it to the market. HIMS, I hate when these headlines, you see the Amazon of something run away, but in this case, I do believe it's true. HIMS is setting up to be the Amazon of healthcare. So I think the two main themes that are going to power this, and the management I think has just been exceptional in just seeing where the ball is going to go. Number one, the grift is over. Sorry, big pharma, healthcare, big food. People have woken up. It's over. They don't want to eat poison anymore and be sick. And this is something that seems especially unique to America. Europe and Canada do a better job of, they don't put the red dye in their cereal and the Gatorade. It's just us Americans who get the pleasure of, eating this garbage and then also paying for the highest cost drugs in the world. HIMS is fixing this all. HIMS cuts out the middleman of insurance. And again, as I said, you obviously still need coverage, but there's even options for that now. I'll talk about that in a future video outside of health insurance for your emergencies. But I think emergencies, HIMS has you, increasingly, HIMS and HERS will have you covered for all your needs. This is happening. So this is going to be the Amazon of healthcare. Again, I don't use that term lightly. I hate when it's 99% of the time you see that as a headline or a YouTube video title, run away. But I truly believe it's an accurate description in this case. I'll wrap this up. HIMS is becoming the Amazon of healthcare. You pay how much every month? Let me know in the comments. How much do you pay for Netflix, all your streaming, all your shopping, all your Costco membership, What price would you pay? Would you be willing to pay to feel better every day, to have more energy, to live longer, to just be around longer, to play with your kids? What is that worth? And that's the answer for how much money can HIMS make. Mic drop. HIMS is under an $8 billion company right now. I mean, the healthcare market alone is $5 trillion. This company this is infancy. I haven't been this excited about a stock probably since Tesla in 2019. Let me know what you guys think in the comments below. Look forward to chatting with you. Don't forget to subscribe if you enjoyed this. Check out my other videos on HIMS. I'll see you guys in the next one.